I'll be speaking to you today for the first part of this kind of session, and the second part will obviously be coming to you then from Charles. Before I start, I just wanted to explain that the presentation that I'm going to give today is not really from an academic perspective. It is more based upon my experiences of being a volunteer helping older people during the pandemic. It does have academic connotations because obviously I am an academic, and it also has connotations then for research, policy and practice. But this is very much my experience of providing informal support to older people within my immediate local area and slightly wider than that in the Swansea area over the past 12 months. So before I talk about the type of support that I provided, I just wanted to talk about how I found the people to support, because obviously things haven't been normal over the last 12 months. We haven't been able to just go into premises like we would have normally, perhaps when we're doing a piece of research. So this all began by connecting and linking up with some of my local area coordinators in the Swansea area, and they actually distributed a number of these Can I Help forms. So I would just fill in my name, my contact number and my email address, and I would literally go through different streets and roads within my local area, posting them through front doors. And I had a number of older people then contact me to say, yes, please, could you pick up shopping? Could I have a food parcel? And could you post mail as well? The main thing, however, though, in terms of finding the older people, was an informal word of mouth strategy. So it was my own family and friends, and it was saying that I know, for example, Mr. Jones, who lives on this particular road, that could do with some help. The other thing was referrals from a local hospital in Swansea. An NHS worker that I know referred a number of older cancer patients actually and said these people are in need. So I also supported them. It all started by providing practical support by visiting a food bank in the Swansea area on a weekly basis. So it was a kind of food parcel that was free of charge through donations. Now, why did these people need support? So this may sound quite obvious because we have had this stay-at-home message kind of drummed into us a lot by the government over the last 12 months, but particularly for older people or those with kind of underlying health conditions, many people have been shielding and isolating for prolonged periods of time. So that may have been compulsory, as it says there, but as things are moving forward, even though some of those guidelines have relaxed, many older people are still fearful of actually going out there to a supermarket or picking up a prescription. So it is something that is actually remaining with us at the moment because people are fearful to go out. Also, many of the older people that I've supported either have a very limited or a non-existent social network. Even for those who do have family and friends, they are often living further away and not within a local vicinity then to be able to provide support. Now, the types of support that I've provided, I've already alluded to this. So it was primarily starting with food parcels once a week for older people. Other things, then it was posting mail for people, and it was also delivering prescriptions. So people would ring me up or send me a message or even call me across a garden wall if it was one of my neighbours and say, could you perhaps post this parcel or pick up a prescription for me? Other things was donating kind of books and being a mobile library on foot for people within my local area. And it was just kind of giving books to older people to give them an interest and to keep people engaged during the pandemic. Something else that I also did with another colleague of mine at Swansea, Dr. Deborah Morgan, was produce an online kind of wellbeing guide with hints and tips for older people and the general population, all people really, of how to try and keep your wellbeing at a decent level during this really tough year that we've all been through. So although I've talked very much there about the practical side of things, even though it was literally delivering food to people, it became more personal than that for me as a volunteer. So I really got to know the 8 people that I was able to get to know really, and deliver food parcels to. So this particular image here, it just shows that one lady, again, she was a cancer patient, and she liked tulips, and this was last spring. So I bought some tulips when I was on my own weekly shop and gave them to her, and I wrote a kind of handwritten message in a little envelope and gave it to her and her mum and dad, who were living in their 90s, and just said that I was there, and if there's anything they needed, just to get in contact with me. Now, these experiences and these kind of relationships I established were apparent because I was contacting older people that I was supporting in between the delivery of weekly food parcels, which would be every Wednesday morning, or they would contact me. So it would be a Facebook message, a phone call, a text message, how are you, and just general chit chat, really. What I was able to do, though, through these establishments of these new relationships, was really get to know what people's interests were, what their hobbies were. And it became so apparent at an early stage, I would say, over the pandemic, that people need so much more than just practical support. They need more than food, a basic human need. They need more than a delivery of a prescription, and even more than a phone conversation now and again. So what I decided to do was put together some personalised hampers for people, and I was able to do this through the help of family and friends, again, who were really kind and gave me donations, or they gave me money and I would go out and buy the supplies, and also through other local area volunteers. So we came together and were able to put together a number of personalised kind of packages or hampers. So the bottom right image, just to give you an example, was one older man that I was helping. He lived alone, he didn't have any family and friends, and he loved to read, and he was a creative writer. But he was actually telling me how his benefits had been affected over the pandemic, so money was really tight. So I got together a number of books for him, some stationery, some writing pads, and he also told me that he liked a beer when he could afford it on the weekend. So I included some beers and some chocolate just for him to enjoy some things personally then. And the top right image as well, in case you're wondering why there are some children's packages and children's cupcakes in there. That was for an older lady that I was supporting that had a young grandson living with her, and she wasn't able to go out because she was shielding, and she was saying how difficult it was to have that young child living with her. So another really kind lady in my community donated some supplies for the grandson, and we also got to know what the lady liked herself. So there was some beauty products and self-care items in there as well. I've already kind of touched on how this support was provided. It was very much on a donation basis. It was going on social media, asking people to help, and people were really kind. I do have to add that in. I just wanted to talk as well as the kind of personalised examples that I've given you there, about the wider community support that was going on within my immediate local area. So this is just a drop in the ocean in terms of what I did and what the people in my street did and within my local area. This, I've seen different newspaper reports and headlines. This went on in a number of places across the UK and probably on a global basis as well. But what we decided to do, just to give you a bit of a fun insight, every Friday evening when lockdown began, myself, my mum, the bottom left there, my partner Gareth, and neighbours that were living in our immediate area, we came up with a different theme. So the first Friday night theme we did was a French night. So you can see my wonderful older neighbours there, Sandra and John. They decided to make a French bistro on their decking, and the neighbour in between us, she just created French flags, printed them off. We had onions hanging, my mum dressed in a beret with a baguette, and we just had a really good evening talking, playing French music, having wine and food, and just being together really outside. Other things that I would do was literally sit on the pavement, as you can see there in the image, and chat to my older neighbours, have a drink with them, and because we were socially distancing, really, we were able to do that then with the nice weather. And just very quickly, the two right images, again, my mum, she decided to decorate the house. She does it every year, but this Halloween, she really went to town. So she decided to create a bit of fun, and she put witches' legs made out of old kind of swimming floats in a plant pot to look like a witch had fallen through the plant pot. And I just wanted to share a very quick kind of moment that I was able to capture, which I'm really grateful of. It was an older gentleman that was walking past, And he just paused for a few moments and looked at the witch's legs and just had a good giggle to himself. And he walked off down the road and he just had a big beaming smile on his face. And I just thought that's a lovely way and just a small example of bringing people together through the tough times that we've been through. I did just want to mention briefly VE Day and how the older people that I was supporting, whether that was in my immediate neighbourhood or in the larger Swansea area, talked about how socially distanced street parties reminded them of times gone by. So whereas people would celebrate jubilees and things like that on the street, we did it again for VE Day. And then it was a real good thing to do for intergenerational practice as well. So it was children, older people, middle-aged people, it was everybody coming together just to enjoy a few hours on that special day. So this is just a clip that I wanted to play, and this was actually from a street nearby where I lived. And this is a man that was able to play the last post. So I just wanted to share this with you for the purposes of the conference. So I just wanted to share that with you, just to reflect really on how communities really have come together over the last 12 months. And I think some of the key messages, which I'll talk about in a moment to round up, is about how we foster those amazing things that have gone on going forward. Just very briefly, from a provider of informal support, I wanted to just mention how it gave me a sense of purpose on an individual basis. And that was by giving me a new routine, because I think we were all flummoxed to begin with, working from home, having this new sense of working, and it was really strange to adapt to. So to be able to help other people gave me a sense of structure into my days and my weeks. And it all also helped by providing me with a level of reassurance when I knew how many people, older people in particular, needed help and support. Knowing that the needs were being met, that gave me reassurance. More important than my particular outcomes were the outcomes for older people that I was supporting. So I can't express enough how much gratefulness and gratitude I received in a number of different methods from the older people I was supporting. This came in the way of homemade or handmade face masks to keep me safe when I was delivering food parcels and doing different things in the community. People giving me hand gel, sanitizer, giving me thank you cards, sending me personal messages, flowers. And one lady who I built up a really good relationship with, Hazel, there's a quote from her there. She actually bought me new things for my new home that I was in the process of moving into at the time. The reason I've got a box of Strongbow there as well, just to add, is because last summer that was a new kind of cider to come out, which I really wanted to try. It was Strongbow Rosé, which would be really nice with ice, and I couldn't find it anywhere. And I was having a conversation with one of the older men that lived on my road, and I said, I've been everywhere looking for it, Graham, but I can't find it. And the next morning he knocked the door and he'd gone to the supermarket and found it and given it to me as a thank you. So I think that just goes to show how grateful the older people were. And it really goes to show that they want to contribute. It's about reciprocation, and that is the key message in all of this to come forward. So the very last kind of outcomes and messages, the points to take away that I wanted to draw upon from this brief presentation that I've covered, is that the practical help I started providing older people with, the food parcels, really did transfer into social support. So it was getting to know people, it was conversations with people, and it was getting to know about them as individuals. What were their likes, what were their hobbies, what were their interests? Because we need to meet those psychosocial level of needs if our well-being is to be maintained or improved during these difficult times. Something that really struck me as well, and I've had many conversations with colleagues since I've been given this informal support, is how helping older people across the pandemic, and I must add this, particularly older men in my experience in my community, how it broke down long-standing barriers of loneliness and the stigma of saying, I am lonely, I am isolated, and I do need help. We were reaching out to people. Well, I was reaching out to people along with other volunteers. And because everybody, the same neighbour Graham told me, was in the same boat, he was very forthcoming and willing to accept help. But the thing in all of that was accepting such help reciprocation. Every single older person, that I helped, they really did want to give something back to myself and to the wider community. So I've already talked there about some of the ways in which they thanked me and reciprocated. They didn't have to do that, but it's what they wanted to do. This holds a really important message because, as Helena was talking earlier on at the beginning as the keynote speech, older people in this pandemic have experienced a high level of ageism, which is there in our society, as we all know already. But being labelled as a vulnerable group or a dependent group just because you're over 70 doesn't necessarily mean that older people are vulnerable and dependent. This small example that I provided today shows that they are contributors, they're active consumers, and they're key members of our community. And the final thing that I wanted to say really was that from my experience, informal support works. We need to foster these relationships that we have as individuals with older people to go forward, just to make sure that people are no longer lonely. It's 2021, and loneliness and isolation and depression and things like being cut off from society are still profound, and we really need to address these issues. So if one thing is to be taken away today, it's how do we foster informal support going forward? How do we protect these important relationships? And how do government help do that? So what can they do to actually accommodate the busy lives of those who provide informal support? Do we need to be looking at things such as flexible working policies and other aspects beyond that?